Let me sanctuary, pure and holy. Hello once again, Ask the Gynaecologist. This is Dr. J, and tonight it's a Friday, and I'll be doing an open session today, open clinic, and it's going to be a wonderful one. I know it's been a while. I've been on live show on ATG. It was because I was on call all through the week, and today is my first day off, and I had to do some few house chores to get things back in shape, you understand. So it's been a busy one. That is why I've not been able to come up live to do our routine talk. So, but if you've missed anything, you can always catch up here on our Facebook page. So we are live simultaneously on our Facebook page here and also on our Instagram. And tonight is going to be an open session, an open clinic session, so that we can answer a lot of questions that people might have. I'll try and bring my whiteboard closer so that people can see and benefit from the discussion, just in case we have anything to draw on the screen. I don't know if people can see me here from Instagram. So you can see me live and clearly from Instagram page, on Facebook page, and we are also simultaneously recording, like I said, on publication for YouTube. Happiness Okeke, good evening. Victoria Jolayemi Abolari, Diana Ali Maga, thank you so much. And on Instagram we have Star Beauty Makeover NGC. We have Gladys 266. Hello, how are you, Gladys? And we have NGC. We have Teams Collections and Star Beauty Makeover, Gladys 266, and Siska on Instagram. On Facebook here we have Grace Isaac, and we have many people coming up live now. So if you're just coming up, good evening to you. My name is Dr. Alalade at Ask the Gynaecologist, and tonight is going to be an open session. And when I say open clinic session, which is tonight, is going to be an open one for you to ask questions that you might have, so that I can answer your questions tonight, and we can obviously rub minds together. We have Chinyere Amechi, Grace Isaac, Happiness Okeke watching us live. Let your friends know we are talking live and we are ready to start today's session. It's a Friday. Usually Fridays we talk about how to improve our sex lives, and I've taken a break from that over the last few weeks, and we're going to come back to that soon. Asha Young, my baby Michelle, she's doing amazing. Thank you so much, Asha Young, for asking. Bumi Ajayi, welcome. Lebechi Clara Chi, welcome, good evening. Spencer069 on Instagram. Fatima Jinadu on Instagram. Thank you so much and welcome once again to this show. If you're just watching for the first time, my name is Dr. Babajide Alalade, one of your team members and admins at Ask the Gynaecologist. And we have Carol, Gabriel, Pelagi, Peggy, Lebechi, Clara Chi, welcome. Spencer069 on Instagram, thank you so much. And we have Onida Mola Jimo on Facebook watching us live. So we're going to open this floor soon and then we'll start talking. Yeah. If you've not yet watched my video on making sex tastier on YouTube, that video is going viral. It's time for you to watch that video and you'll be amazed at the things you will learn that can, and also unlearn, that will change your lives, change your bedroom lives tremendously, and will make things happen beyond your understanding, and it will change your lives. A lot of marriages today, I can tell you something, they are suffering, and they are suffering because the sex life is dull. The sex life is dull. My father used to say this thing to me, that if most people are having lovely time, I mean couples in their bedroom, most of the time their problem is solved, because in the bedroom two of you merge to become one and you form a stronger, formidable third person, and that third person, the two of you will form by your union together, you'll be able to surmount any challenges that come across you. That is why if you see any marriage suffering, usually the bedroom is suffering as well. Sarah Okonkon, thank you. Blessing Equere, Regent Williams, Enigbo Gamodinat, Alima Adamu. We have Claro Gabriel, Irina Molajimo, Oluwa, Foyonga, Andelin, Lena, Chinyere Amechi. We have we have Sylvia Duru. We have Blessing The names are flying off my face. I can't see them. We have Pelagi Peggy. We have Claro Gabriel, Irina Mola, Sylvia Duru. We have Happiness Okeke, Victoria Jolayemi Abolari. Good evening, Diana. Diana Ali, thank you. We have Joyfulness 30, Prince Uruka, BJ Pumping on Instagram. And then we have Spencer 069. 069. That's a wonderful name. 069. It can be a quote from something else. Anyway, I'll try to keep my my presence here fully aware. Thank you, Spencer 069, for joining us today. Welcome to the show tonight. And like I said again, if today is your first time, thank you so much. Yeah, I was talking about the making sex testier video that is going viral from myself on our YouTube channel. This video is one of their most watched videos. If you've not yet watched that video, you're going to learn a lot of things, unlearn a lot of things that will spicing up your sex life beyond your thought. I'm so tempted to want to talk about sex and how to improve sex life tonight. I might eventually talk about it tonight, but I want to focus on this open clinic session today to answer people's questions. That there will be various questions around. My chief Natalie, thank you, my chief Natalie. Adenike for me, Commander Tega Mamadou. Good evening. Aminat Aziz, thank you so much. Hello. Olubukola Omonogun, Aminat Aziz. We have Tega, we have Babajide Alalade, we have Olubukola Omonogun. Praise Wuhuka. Onome 4B. Excuse me. Charming Johnny. We have Orano Stella Ifi. We have Dorothy Zan Patrick. Chiamaka Glory. Glory of God be upon your life, my sister. Unwama Jermaine. Adebayo Adenike Aderonke. We have Unity Beneth. Unity, have you watched that our video on YouTube? This making sex testier video? If not, please Unity, watch it now and share it with your friends, okay? Ifi, Nina, John, Agu, Osakwe, Jessica, Ijeoma, Ekweme, Queen, Demani, Osakwe, Jessica, Victoria Yemi is saying that you were induced to have your first 2 babies. You never went into labor yourself, even when your water was leaking. What could be the cause? Is it possible you go into labor yourself in your other labor? Yes. Every labor, every pregnancy is entirely different from anyone. The fact that, but sometimes what happened in your previous pregnancy can also happen in your, or repeat itself in your future pregnancies. If someone's had an heavy bleeding in their last pregnancy, sometimes their bleeding could be heavier in this current pregnancy. So if someone bled a lot during delivery of their first baby, they could bleed a lot in this new pregnancy they have. So if you've you're induced in your previous pregnancies, yes, definitely you can still go into labor yourself in your 3rd pregnancy. Because you were induced in your previous pregnancy doesn't mean you're going to be induced again. But to be honest with you, your chances of being induced again is high, because you've been induced in your last 2 pregnancies. So, but there's still a chance for you to go into labor yourself. Trust me, because every pregnancy is different. Good doctor. You treated your malaria twice now, but you're still having pain in your tummy and weakness. You ran a test. It says you have malaria. Let me tell you something about malaria in Nigeria. If you run malaria tests for 10 people in Nigeria, 8 of them will have malaria parasite in their system. But not all of them will be clinically sick of malaria. The thing is that because malaria is endemic in our country in Africa, malaria is endemic, you're going to have malaria parasites found in your blood. That doesn't mean you have malaria. It means that, yes, you have some sort of exposure to it. But however, if you're unwell, running fever, temperature, that means you've got malaria infection. That means you've got malaria, malaria itself, and you're infected and you succumbed to that parasite. For that, you need to be treated. And if you have malaria, whether you're pregnant or not, malaria must be treated whether you're pregnant or not. Okay, Osakwe, Oshogwe, Elsie. Doris John Akwereshi, how are you doing, my sister? Osakwe Jessica, your question says you remove cervical polyp in 2019. You want to get pregnant. What should you do? Cervical polyp does not stop you from getting pregnant. But it's good if you remove it anyway. It's good because cervical polyp can make you bleed irregularly or bleed during sex. It's out, good news. But if you're not able to get pregnant, you're having regular sex 2 to 3 times a week, and the only time you're free from sex is during your period, you're doing that every day for the last 1 to 2 years, you can't get pregnant, you should start doing tests for infertility. Tests will include checking the semen count, checking whether you're ovulating, and checking whether your tubes are blocked. To check your semen count, you know that already, semen analysis. To check your tubes, HSG. To see if you're still ovulating, we check your LH, FSH hormone, prolactin, progesterone, and so on and so forth to see if you're still ovulating. Those are the things we should do for you. There's a question here on Instagram. Okay, no question on Instagram. So Instagram is okay. Let's go back to Facebook. Doctor, talk on cervical polyp, fibroid, and conception. That's a lot of things. So I'll put it down here. It's a lot of, I can't talk about everything. It's so much. I have a video on fibroids. You want to see me to talk fibroid, cervical polyp, and something else. I can't see that thing so fast. Can one get pregnant when you have an implant? Very, very unlikely. If you have an implant that is still in date, implant is a form of contraception, then you probably not get pregnant if you have implant on. To get pregnant, you have to remove that implant. But I've seen people that get pregnant while implant is on, about 1 in every 100 patients. So it's very rare, but it's possible. Can ulcer affect conception? No. Ulcer does not affect pregnancy. It doesn't cause infertility. Good evening, doctor. You have hormonal imbalance. What makes you miss your period? That makes you miss your period? Something like that. I can't see that question. That question is gone. No, Jermaine. Can a woman get pregnant with 5 centimeter fibroid? Yes and no. I've seen people with 10 centimeter fibroid, they're pregnant. But in most cases, it depends on the size and the location of the fibroid. If the fibroid is in your cervix, blocking your cervix opening, it's likely to make you not to get pregnant. So it's the size of fibroid and location that really matters. So if you have 5 centimeter fibroid, you can still get pregnant. You can, but you might not. So it's either way. Please, doctor, what is YouTube link? Can one of our moderators please put up our YouTube link so that this lady or I don't know can watch all our videos about sex? Evening, doctor, what is the treatment for hemorrhoids in first trimester? If you have hemorrhoids in first trimester, take lots of fruits, drink lots of water, at least 2.5 liters of water. Get anosol cream. Anosol cream helps to soothe the pain from hemorrhoids. And hemorrhoids in pregnancy is likely to get worse in your 3rd trimester because as your pregnancy progresses in time throughout the whole trimesters, there will be much pressure on your veins in your rectal and your inner area, and that pregnancy will make your veins engorge. It's common in pregnancy for people to have hemorrhoids, so you have to take lots of fruits, lots of water, and get anosol cream and stool softeners to reduce the pain and constipation. Good evening, doctor. What can I do to put an end to my hyprolactin in order to get pregnant? If your hyprolactin is high, you have to go and get bromocriptine powder to treat and bring it down. And if it's not coming down, you have to see an endocrinologist as soon as possible. Please. What causes no nuchal cord? You lost a baby due to that. Nuchal cord. So maybe the cord was tight around the neck. Nobody knows. You see, the cord of a baby is like a long telephone wire. In the womb, they are cord everywhere and they can move anywhere. I've seen many babies that the cord was around the neck while they are coming out. Some twice, some once, some even 3 times. And some of them, they don't have any problem. And I've seen people that babies died in their womb before they even had labor and the cord was around the neck tight. So, but there's no way you can prevent the motion or the mobility or how the cord moves and floats around in the water of the baby. No, and there's no way anybody can predict that. In fact, scans cannot really actually pick up cord if it's around the neck or not. It's difficult. But some can do it, but it's difficult to use scan to predict or to know if there's cord around the neck. Doctor, good evening. You were pregnant in 2017. Since then, you've not been able to get pregnant again. Enweram Suzette. 2017 is about 5-6 years ago. It's been too long. You're not able to get pregnant now. We have to go back to the beginning again and do all your hormonal profile, osmolar sperm count, check your tube because what? This is secondary infertility. Anything in your body could have changed. Can a woman conceive with ovaritis? If you have an infection in your ovary, ovaritis you mean. If you have an infection in your ovary or infection in your tubes, infection in the ovary can cause tubal abscess and that can damage and block the tubes. So if you have infection in your tubes or your ovary, it can cause damage to your tubes and that can make your tube blocked and that can cause infertility. And what does it mean when your doctor says that you have lesion on your left ovary and you can't conceive with that? In medical world, when we say lesion or pathology, it means abnormality. So it depends on what they mean by that lesion. If that lesion is that you have an infection in your tubes or on your ovary that has blocked your tubes, then that means that your tubes are blocked. You need to, consider some sort of treatment to treat it. Can a woman be done? Can operation be done on 6 millimeter or 6 centimeter chocolate cyst? Yes. If you have a chocolate cyst that is 6 centimeter, it should be removed because it can cause pain and it's probably going to get bigger. Okay, any cyst above 5 centimeters causing pain, including endometriosis cyst, chocolate cyst, must be removed. Okay, Bold, excuse it, my sister, my cousin, how are you? Thank you, Bold, excuse it. All the way from United Kingdom, Bold, excuse it. Thank you so much. Thank you so much for seeing you again. You went for HSG test in the morning, and you're having serious pain since morning. You are rushed to hospital at Dopemu this night. What is the cause? If you have an HSG, okay, thank you so much for coming to our hospital in Dopemu, Alalade Hospital. Now, if you had HSG done, definitely it can cause some cramps. Not everybody will have pain and cramps from HSG, but it can cause what we call, kind of irritation in your tummy. And simple painkillers, IV fluids, and treating any possible infection that may have, if it's any infection there, can help to elevate your problems. Okay, painkillers, IV fluids, and we give you some antispasmodic. They help with the pain from HSG. All right. Olebube, you are welcome. You're not late. Ujunwa Eze Ogbona, I'm sorry, I may have missed your question. Probably your question came in while I was answering another one and I've missed it. Ujunwa, let me know your questions, okay? Ujunwa Ogbona. Florence Elili Buzeni, your prolactin is 21, progesterone is 39, is okay. Prolactin is 21 is okay, progesterone 19, that 9 is okay. That's fine. Can CS cause secondary infertility? Yes, it can. Very, very rare. Especially if the CS is done in a proper way, it's unlikely to cause infertility. I've seen many people that are CS and they are pregnant now. However, if during that C-section you had an infection that has caused damage to your tubes, it can cause infertility because cesarean section itself increases the risk of what we call endometritis. But the number one cause of endometritis is cesarean section. So if you have endometritis, that is the infection in your womb from C-section, okay, it can move into your tubes and damage tubes. That is the secondary cause of infertility. How long can a woman wait after CS to have delivery? Give yourself at least 12 months after C-section before you get pregnant again. And if you've had 2 sections, the next delivery should be C-section again. Can 80 million sperm cause delay in pregnancy? Yes, it can. It can. It should be at least, I'll say 40 million or more. What's the difference between primary and secondary infertility from Oluwebube favor? Primary infertility is that you are having challenges getting pregnant and you've never been pregnant before. If you've been pregnant before and you're still not able to get pregnant, it's called secondary infertility. So secondary infertility is that you've been pregnant before, but you're having challenges getting pregnant this time around. Can pregnancy, if right tube is blocked and left is open, you can get pregnant if one tube is blocked. As far as one tube is okay, that tube can pick up any egg released from the left or on the right. But once you get pregnant, even if you have only one tube, always ensure you do a scan at around 5 to 6 weeks of pregnancy so that we know that the pregnancy is in the womb and it's not outside the womb. Is bleeding normal during pregnancy? No. Bleeding is not normal at any point in pregnancy. The only time you're allowed to bleed normally as a woman is during your delivery and during your normal scheduled period. Any other bleeding is abnormal. So if you're bleeding in pregnancy, get checked out. You have a risk of losing your baby, a risk of miscarriage. Can urine infection affect getting pregnant? Very unlikely. Oluwebube, can blocked tubes be open? Yes, but very unlikely. Once your tube is blocked, we can do hydrotubation to unblock the tubes. But hydrotubation only works in only 1 out of every 4 patients. So the success rate of hydrotubation to unblock the tubes is very, very low. Not all doctors do this though. If your tubes are blocked, the best thing will be to consider IVF as soon as possible before we waste time. How will someone know if she has infection on her ovary or tubes? Usually, infection on the ovary or tubes can be suspected while you have a scan, but it cannot be confirmed by scan. If we scan you and we suspect what we call Tubal ovarian abscess, we can now do swabs to check for infection. Sometimes you're already sick and we scan you and we see something that looks like an abscess in your ovary or on your tubes. That will confirm our suspicion that this infection you have that's making you sick is probably from that Tubal ovarian abscess, which is infection of the tube. My doctor said 24 months. It's up to you. Loretta, I think I've answered your question already. 12 months, okay? What are the symptoms if pregnancy is not in the womb? That is ectopic pregnancy. If your pregnancy is not in the womb, the first symptom you have is that you missed your period. Number 2, you could be having pain on that side of your tummy where the pregnancy is in the tube. You might even have what we call light bleeding. You might even be feeling dizzy, and you might be even having spells of dizziness or headache, or also having pain on your right shoulder. Those are the signs of ectopic pregnancy. If you are pregnant and you're having pain on one side of your tummy, the first things first, if you are between 4 to around 8 weeks pregnant, you're having pain in your shoulder, you're feeling dizzy, you're having bleeding, this is time for you to go and get scanned to see and to check whether your pregnancy is in the womb. From Instagram here, can Griseofulvin be used for first 4 weeks of pregnancy, cause deformed baby? If you're pregnant, you should not use Griseofulvin. If you use Griseofulvin accidentally, then stop using it and get a scan done around 12 weeks and also at 20 weeks to check if there's any abnormality in your baby. But it's unlikely to cause problem. But don't take Griseofulvin in pregnancy. Can adenomyosis cause infertility? Yes and no. Very unlikely. But in very, very rare circumstances, adenomyosis can cause pain during fertility. But it's very, very rare. Adebayo says, I discovered that I have bilateral tubal occlusion when you went for HSG in July, and afterwards you did a scan. It shows that you have endometriosis. What is the way forward? Adebayo, Adenike, you have both tubes are blocked and you have endometriosis. I won't lie to you, okay? You gotta need IVF. Is loratadine good in pregnancy? The loratadine is okay in pregnancy, but there are many other anti-allergic medications you can use, like a cetirizine, like you know, you can use for allergy in pregnancy. So I suggest don't take loratadine, use other safer ones, okay, like cetirizine. They are better ones. Test the pregnancy positive, not in your scan. If you're pregnant and you are less than 6 weeks pregnant, you probably not see much on scan. If you're pregnant and you are less than 6 weeks, in most cases, you probably not see anything on scan. Okay, which scan test will you do to check your air quality, hormones, and your body? There's no scan test to check your air quality. There's no scan test. We'll see. There's none. The test to know whether you are producing enough eggs is your AMH. The test to check your air quality, there's no test to check air quality. We know air quality if we are doing IVF and we are looking at the eggs under the microscope. We can see the way the eggs are dividing. Then we know that this egg is good quality. There's no way anybody can do any test to know the air quality. What are the signs of tubal blockage? There's no sign. But if you have an infection in your tubes before it leads to tubal blockage, that will cause pain, offensive discharge. That is infection in your tube. So those are the signs. Now, if this infection in your tubes are not treated, it will now cause tubal blockage. And by the time you get to tubal blockage, there's no sign anymore. We only sit on HSG and we find out that your tubes are blocked. Can simple ovarian cyst 41 millimeter affect pregnancy negatively? Very unlikely. But if it's twisting on itself, it's causing pain, then it's good to remove it. We try and avoid removal of cyst in pregnancy, but if it's necessary, it's causing you pain, then you have to take it out. Then we take it out. What is the cause of vaginal pain in pregnancy? Ligament stretch pain. Take some painkillers and get some good rest and drink a lot of water. Good evening, doctor. Please, what is the cost after my period is ovulating? Blah blah blah. Patrick Doherty. I can't read your English, so please send it to. Can 18 million sperm be used for IVF? Yes, we can use it. We will try and spin the sperm on the centrifuge, pick up the best sperm and use it for IUI. We can use 18 million sperm for IVF. Yes, we can use it. We can Agege, Christopher, we can use it. Can DNC affect menstrual cycle? Yes. If you had a DNC, it can make your period the next one scantier or slightly heavier sometimes. So DNC can affect menstrual cycle. But after 2 or 3 months after your DNC, your cycle will go back to normal. Doctor, is yoni pair advisable? I don't know what yoni pair is, okay, and I won't advise it. I don't know what yoni pair is, but from what I know about yoni pills, it's unsafe for your vagina. But you know what? Guess what? Most people would not listen to me. They're still going to put yoni pills. They're still going to put anything in their vagina. Despite the fact that we told them this, some people will not hear. But until they see what their eye want to see, then they will not stop. But yoni pills is not advisable to put in your vagina. Your vagina is your private part. If some people sit down and they think of what they put in their vagina, they know that actually they are being funny. You don't put stupid things in your vagina. So don't put unit pills. Now, this is not for you, my sister. I'm not fighting you. I'm just talking to people generally. So don't take it out on me. I'm not fighting you. I'm just telling other people, listen to me, that unit pills is not safe. Okay. If one does not discharge, can a person be pregnant? You can be pregnant now. Just do test of pregnancy. If you think you're pregnant, do test of pregnancy. This day and age, we are beyond guessing. If you think you're pregnant, walk to any pharmacy and do or buy test of pregnancy. What causes breast pain in second trimester? Because you're pregnant. If you're pregnant, your body is producing lots of prolactin to get your breast developed and ready to feed the baby. So that breast is getting bigger. It's stressing your muscles here. That's why you have to adjust or get a new bra during pregnancy to accommodate the increase in size of your breast. Your breast will get bigger in pregnancy, sometimes during your menses. That is because of the progesterone trying to make the breast bigger to accommodate the extra weight. What causes baby to stop growing if your baby is not growing at first trimester? It could be an infection causing it. It could be rubella. It could be chromosomal problems. It could be that the embryo is not dividing and is died. It could be from placenta failure. All this can cause that. Okay. Doctor, when seeing your period, your blood is dark. What is the cause? It's normal. There's nothing wrong. There's something called dark blood. If you're bleeding and you're having a period, there's nothing wrong with the color of dark blood. It's normal. There's nothing wrong with it. But if you have a discharge, offensive discharge, then get checked out for infection. Your cervix is blocked. What can you do to open it? You can do cervical dilatation. Go to ATG office, call them tomorrow, and get booked for cervical dilatation to open your cervix so that you can get pregnant. Ija Ukayat Adishokwe Kazim, welcome. Thank you, Ija Ukayat Kazim. If someone, yes, Florence, I've answered you. Can IVF be done if both tubes are blocked? Yes. If your tubes are blocked, much better, or if anybody's tubes are blocked, for example, not you, not anybody else. If everyone, if your tubes are blocked, then definitely you need IVF, because 3 things can cause infertility. I say this all the time. Sperm problems. Number 2, blocked tubes. Number 3, ovulation failure. If your sperm is okay, we check your tubes. Okay, we now go to check whether you're ovulating. SB Ito, thank you all the way from Abuja, Nigeria. Welcome once again. Eponosi Oju, Marian Asuko, Temitopa Kisoya. Thank you, good evening. You're not pregnant, but you feel pain in your nipple. What is the cause? It's probably what we call cyclical breast pain. At different points in your cycle, some people will have pain in their breast. It's not unusual. It's very common. After having missed abortion in March, that question is gone. Mr. Abortion. I missed that question of Mr. Abortion. Doctor, what's the cause of breast milk when you're not feeling pregnant? Probably you have high level of prolactin. Is it normal for urine to smell bad after delivery? If it's not normal. If your urine is smelly or offensive smell, your urine is smelly, offensive smell, or when you're passing urine, your bladder opening there, that's your urethra, is very, very sore and stingy. It could be signs of infection. So get checked out. If your urine is smelling offensively, that could be a sign of urinary tract infection. Get checked out, and if possible, start antibiotics. Thank you, my sister. I can see my wonderful childhood friend. I think I missed your picture now. I'm trying to look for you. Abimbola, thank you so much. Abimbola Oluwashon Babarala, thank you so much, Abimbola. God bless you. I really appreciate you. And she's my childhood friend from the same church. We grew up together, and I still remember the days we go through the school bus back from school, back from Ikeja, Agege to Agege. Thank you so much, my sister. God bless you. I hope my other brothers are doing fine. Abimbola, it's good to see you again. I really appreciate you, and I appreciate you so much. And God bless you to your family. God bless your children as well. And God will open doors for you abundantly. And to all our viewers watching me tonight, I say I love you all. And when I say I love you all, I sincerely mean it. And I have no doubt about it. And I love myself too. Now, Instagram here. Why is there still lumps of blood in my period 5 months after miscarriage? Difficult to answer. It's a big question. Now, if you're having heavy bleeding 5 months after miscarriage, first of all, get a scan. Let us check your womb cavity. Is there anything unusual in your womb cavity? First of all, get a scan, okay? And then we take it from there. It could be that you have fibroids or you have a polyp in your womb cavity. Your womb scan will do. pelvic scan. And if necessary, we can even do what we call hysteroscopy, where we put a camera to look into your womb cavity. We can get that done at ATG IVF Center. At the ATG IVF Center now, we have a 2D, 3D, 4D scan, hysteroscopy to look into your womb, high definition hysteroscopy. Hysteroscopy is to have the camera to look into your womb. And if you're pregnant, we can do a 4D scan. And you can see what your baby looks like before your baby is born. And even if you're pregnant and your pregnancy is not going on fine, we can do a scan to check the blood flow in your placenta, check the blood flow in your umbilical cord, and detect problem on time that could mean that you might need earlier delivery. So we do a scan to see if you need earlier delivery. Adaku, Prudence, Blessing, good evening. What does it mean to have pain? That question is gone. I can't see that question. Regent Williams, thank you so much. I love you too, my sister. You're a wonderful name, Regent Princess. Oh, I'm trying to read questions. They're so fast. I can't catch it up. Balogun, I think I already answered your question. Doctor, after doing HSG, 4D scan can show sex of your baby. Our 4D scan can show the gender of your baby. Yes. Doctor, is it after IUI is done that fertilized egg travel through the tube? No. IUI means that we are inseminating a very good sperm into your womb cavity. The sperm is very good. It stays in your womb cavity and it meets the egg that is coming from you down your tubes to wait in the womb cavity. In fact, in some cases, we do regular scans to scan your ovary to see whether your ovary is releasing the egg. So we can even time it when your ovary is releasing the egg by doing follicular tracking scan. And on the right day, we now send this sperm in. We can do IUI with hormone medication to induce or to stimulate your ovaries to produce eggs. Or we can even do it naturally and just wait for your body to stimulate and to produce eggs naturally. And when you're ovulating, by doing follicular tracking scan, we just put the sperm at the right time to eat it. Bitter cola, pregnancy, babu. Don't eat bitter cola when you're pregnant, okay? How can you register for sex selection? Sex selection, the best way to do it is through IVF. That it can be guaranteed. We call that family balancing at ATG IVF Center. You can do it there. And if to do it there, please call our laboratory tomorrow morning. Please, one of our moderators on Instagram, can you put the link for Chioma go gift to register the ATG IVF Center? Can you do IUI at ATG Center? Yes, of course. Iwalola, Oyewole, bitter cola, pregnancy, they can go together. Doctor, please, can low sperm cause miscarriage? No. Low sperm does not cause miscarriage. Good evening, Oputsa Odinakachi. Doctor, after HSG, you took Clomid last month, you did ovulation monitoring, no sign of pregnancy, fertility support, blah, blah, you can't get pregnant. You've tried Clomid. It's not working. Are you ovulating? Have we done your hormonal profile to see if you're ovulating? Why did you do HSG? Are your tubes blocked? Is the husband sperm count good? All these things will let me know whether it's okay for you to continue or to repeat Clomid or to even increase your Clomid. What is the cause of breast milk when you're not breastfeeding baby? Dorothy, I already answered your question. I said it's likely that you have hyprolactin. And what can cause hyprolactin is usually what we call pituitary adenoma. There's a small organ in the brain that controls the production of prolactin hormone that makes your breast to produce milk when you're pregnant. Sometimes this organ in your brain or tissue in your brain becomes funny, and it makes you produce a high level of this hormone prolactin that makes you produce breast milk at the wrong times. So it's likely that your prolactin is high, and if it's high, we gotta treat it. What can make cervix open at 6 months pregnancy is called cervical incompetence. If your cervix is weak at 24 weeks, sometimes there's no obvious reason. Sometimes it could be an infection. Sometimes you had a previous DNC. Sometimes from previous operation. If your cervix is open at 24 weeks, 25 weeks, we have to put a stitch there quickly, what we call rescue sacrilege, to tie your cervix to keep it closed in. What is low progesterone at 42 years old? If you have low progesterone at 42 years old, it's likely that you're not ovulating anymore. But we can't treat progesterone in isolation. We need to look at the LH hormone, the FSH itself, to see what is happening. What causes scanty menstruation? Sometimes cervical stenosis, sometimes polyp can cause scanty menstruation or irregular menstruation or a previous DNC. Good evening, doctor. Chinonso. How do one know she has hormonal imbalance? By doing all the hormonal profile tests, about 6 of them, including LH hormone, FSH hormone, day 21 progesterone, prolactin, testosterone, and AMH to know. This will give us an overview to know whether this is the reason why you're not able to, produce, you're having hormonal imbalance. What causes irregular menstruation? 24, 26, 30, hormonal imbalance. Low progesterone at 42, can it be treated? Very unlikely. But we need to look at your other hormones. Maureen, BOC. Okay? On Instagram here, doctor, is irregular cycle normal? No. Irregular cycle is not normal. Doctor, how can low estrogen be treated? How can low estrogen be treated? We need to know what is causing your low estrogen. Once we know that, we fix it. So we need to check your LH hormone, FSH hormone. If probably your LH hormone and FSH are showing that you're menopausal, then that is why your estrogen is low. In such a case, we can't change it. So we can't interpret the estrogen as isolation. We need to look at other hormones too in your body. What we call the reproductive hormones, LH, FSH, prolactin, AMA, to give us a clue why your estrogen is very low. How can I calculate my ovulation date? Loretta Unwokoye. We have videos on our YouTube page, and you can watch the video on ovulation and you get clarity on how to calculate ovulation. And I have so many videos here on even ATG Facebook where we've done calculation and seminars on ovulation. So watch it. FSA 2. First of all, don't put your result on here. It's not good. Don't put your result on this our page. It's not good. It's not good for privacy. What is the cause of breast pain? Sometimes, first things first is to check for breast lump. Do a self-breast exam. Number 2, is your breast pain cyclical? Is it around at specific times of your period or during your menstrual cycle? Are you pregnant? Are you wearing a wrong bra? You're wearing a wrong bra for a wrong breast can cause breast pain. Okay? So these are obvious reasons for breast pain. Don't put your results here. They are okay. Your prolactin is a bit high, but don't put your results here. Why do some ladies touch something like ball inside their VJ when watching it? I don't know what that is. Probably it's a lump. If you have a lump, if you're feeling like if you have a lump, then get to see a doctor physically. Let them examine you to see if there's any obvious reason why you have a lump in your vagina. Ojunwa, what's your question? Ojunwa, I already answered your question now, Ojunwa. Doctor, can high prolactin be treated? Yes, high prolactin can be treated. What causes leg swelling in pregnancy? Sometimes leg is just swelling normally in pregnancy. But if you have a leg swelling in pregnancy and you're having pain at the back of your leg in pregnancy, that could be signs of DVT in pregnancy. Sometimes too, what can cause pain in pregnancy and the leg swelling? Sometimes people have high blood pressure. If you have leg swelling, high blood pressure, high protein in your urine, it could be signs of blood pressure problems or preeclampsia in pregnancy. Yes, we can. We don't treat men's prolactin. We can't. Okay, we can treat men if they have high prolactin. Okay, we can treat it, but it's unusual for a man to have high level of prolactin. Your address on Facebook. This is my address on Facebook. We are here. We are here. I don't answer private messages on Facebook. I don't. But we are here. What causes high FSH? If you're menopausal. If you're menopausal, you're not ovulating anymore, you're going to have high FSH. What causes blood spotting 2 days after ovulation? Probably hormonal imbalance. Ojuwa Obona, I already answered your question. Probably you ask another question, which is not good now. Let other people ask their own. Grace Ruben, I already answered your question about leg swelling. Grace Ruben, I already answered your question about leg swelling. How can one know if a cervix is open or closed? By getting examined. If you're pregnant, you think your cervix is open or closed, get examined vaginally and then we'll know. Can Asherman syndrome be treated without surgery? No. If you have Asherman syndrome, the treatment is surgery. There's no medication that can go and dissolve Asherman syndrome or scar tissue in your womb. Asherman syndrome, the treatment is surgery through hysteroscopy. Surgery through hysteroscopy. They will put a camera into your womb cavity, that is hysteroscopy, and they will now resect the scar tissue. So, operation to treat Asherman syndrome is called what? Hysteroscopy and adenolysis. Okay? All right. Thank you guys for watching me today. I really appreciate it. I got to go now. I hope to see you tomorrow again, and we have a wonderful time together. Okay? All things being equal. Love you all. See you soon. Bye-bye. Have a wonderful weekend as well in advance. Bye-bye.